Hi, I'm Mary Gandino, the director of the Jones Institute Europe, European branch of the American Jones Institute, founder of the osteopathic technique strain Counterstrain, also known as Jones technique. The Jones technique is a protected trademark, and we are the only authority in Europe proposed to teach this method. In the moment you'll decide to follow a strain Counterstrain course, assure yourself that the tuition is given by the Jones Institute, because there are other realities who boast to teach the correct technique. But not only they do not have the authorization, they even lack in capacity and knowledge to teach the strain Counterstrain technique in the correct and proper way. You'll find yourself at the end to have followed a fake course. What's strain Counterstrain technique? It's an osteopathic, indirect, passive neurological approach, which resolves in a fast and permanent way somatic dysfunctions in with the body. Not only somatic, but even vascular, arterial and lymphatic, fascial, and visceral dysfunctions too. The technique consists in finding specific points in the whole body known as standard points. Once localized, the operator will position the patient's body in a passive and non-painful situation, keeping the segment in this position a correct amount of time that has been seen to be 90 seconds, and taking back the patient's segment very slowly to neutral position. We obtain the neurological reset of the problem by reprogramming the neurological error that is holding the somatic dysfunction. So this is a neurological approach which resets the aberrant signal alpha-gamma, which is maintaining the dysfunction. Compared to other methods, strain Counterstrain has innumerable advantages. For example, the rapidity of the effects on the patient, oftentimes immediately. In fact, right away in the first visit, he can resolve the problem he came in for, even if the problem has lasted for a long time. Second, there are no contraindications in the use of the technique, as long as it's applied in the proper way. Is absolutely atraumatic for the patient. This permits to work in any condition. Is very easy to perform. This allows the operator to work all day long without tiredness. Furthermore, it permits, in the hand of the well-trained clinician, to execute a scan. Yes, let's call it this way, a full-body scan of the patient, permitting in this way to the operator to identify the major areas of dysfunction, allowing him to establish a precise guideline, which will lead him in the future visits. So he will exactly know where to start from, how to proceed, and how many visits will be necessary for this patient to recover. This right in the first visit, and really within few minutes. See, when we say that we teach how to turn on the light on the darkness of manual medicine, we intend even this: the ability to have a clear understanding of the clinical situation of our patient, and knowing precisely how to proceed in the future visits. My main satisfaction is to hear from the attendees of our classes, few days after the course, contacting us to tell us about the extraordinary effects they had on their patients. All of us instructors are really glad to have had the opportunity to expand all over the world this marvelous technique, as Dr. Jones used to define it. And remember that we, as clinicians, have as first duty that of helping others, helping our patients. And this is a technique that really makes the difference within the hands of the operator.